That's great. Thank you, Lucy. I think first off, meet Merlin. Might be able to put something in Ardens about it if it's not already there. That's great. Okay, thank you. Right. Next, Matthew from the BSA again, talking to us about medicine statistics. Thank you.
Hi, hello everyone, and apologies straight away. Oh, sorry, I've already messed up the slides. Apologies straight away, you are going to get a bit of a double whammy of who the NHS BSA are, because we weren't sure what order our talks would be in. But yeah, I am Matthew Wilson, and I am the statistical publication lead at the NHS BSA, and I'm here to talk about our prescribing and medicine statistics. About the BSA, obviously, as we said before, we do lots of things, we generate a lot of data, but the thing that, the service that most people are probably interested in is the NHS prescription services. A little bit about NHS prescription services. So we process 1.2 billion prescription items and pay over £10 billion to contractors every year. We manage and maintain the Dictionary of Medicines and Devices, which we heard about a bit earlier, with help from NHS England. We also publish the drug tariff for England and Wales. And we do a lot in a data space. So we have always been a long-standing prescribing and medicine data producer. And in 2020, we became an official statistics producer. And we do lots of other things as well. So we do open data, we do the English prescribing data set, and lots of other data sets on our open data portal. We manage and maintain the EPAC2 system, which I'm sure lots of people have probably used, sat in this room. And we publish data science articles as well, so work like Lucy's, or other work that we do, such as prescribing in care homes. But before I talk about our prescribing the medicines publications, I thought I'd do a bit of the data journey. I think everyone probably knows about the data journey now from all the previous talks this morning. But briefly, prescription goes to a patient, goes to a pharmacist, it goes to us, the NHS BSA. We process that data. We capture a lot of data from a prescription form for paying pharmacists and for making sure that those costs are then recharged to the correct prescribing organisations. But we also capture a lot of patient information from prescriptions as well, such as age, gender, and a patient's registered address. And then that forms the basis for what we build all of our reports on top of. So, on to our publications. We have 8 prescribing and medicines publications. Of those 8, 6 are at a medicines level, so we'll give you detailed information on medicines. And then of those 6, there are 4 that are focused around specific clinical areas, and it's the 4 that you'll see in the middle there. So those publications we've chosen to publish for a variety of reasons for each one. So for mental health, obviously there was a large focus around antidepressant prescribing, so we've produced some statistics on that, and more recently around ADHD prescribing. We have a diabetes publication because it is one of, if not the largest single area of spend in primary care. We have a dependency form of medicines publication that we produced in response to the Prescribed Medicines Review that was conducted by Public Health England back in 2019. And a hormone replacement therapy publication, which we produced in response to the Women's Health Strategy in 2022. So all of those clinical publications contain analyses and data on patient-level data. And so I've pulled out just a couple of things that we cover in our publications, a lot more high level than Lucy's work, but I think valuable still nonetheless. So this chart that we have here is the number of patients that were prescribed antidepressants by age band and gender, so an age-gender pyramid. And I think it's quite clear the story straight away when we look at a different dimension in prescribing data such as age. So we can see here that if you're a woman, much more likely to be prescribed an antidepressant compared to if you're a man, and that's across all age groups. So it doesn't matter how old you are, then that is going to be the case. And looking at these different dimensions within the data is very important, particularly when we start looking at things through things such as a health inequalities lens. Another example, a very similar one, but this time we're looking at diabetes prescribing. So we can see a very similar story that's happening here. We, again, have an age-gender pyramid for patients that have been prescribed for the last financial year. But there is a bit of nuance to this one. So if you are a middle-aged or slightly older man, then you're more likely to receive prescribing for diabetes. However, if we start to look at the younger age bands, we'll notice that there is, like in general, less prescribing and less patients receiving medications, but the distributions do change quite dramatically. So we have a kind of a flip and inverse. So if patients that are aged 10 to 39, 65% of them are female. And this is a final example of some of the analyses that we publish. And I've chose this one because it goes a bit against the trend of what we might expect to see in our data. So this is looking at the deprivation quintiles of patients who are receiving HRT prescribing. And typically, we would expect to see across most clinical areas more patients to appear in the most deprived areas. So kind of like an inverse of what we see here. But for HRT, we actually see that the patients who live in the least deprived areas are receiving the most prescribing or have the highest patient counts. And this could be for a range of reasons, and it could be due to the kind of underlying demography of those patients. But I think it does suggest that there could be like an unmet need for patients receiving HRT in less deprived, in more deprived areas. So we've had a little whistle-stop tour of some of the stuff that we publish. So now we get to talk about how our data is used. So that's my team's mission statement up there. So our official statistics serve the public good, aid understanding of today's issues, and support better decision-making in key areas of the health and social care system. And I believe that we do just that we achieve that mission statement. We know that we have a wide array of users from national and local government, NHS and ICBs, academics and researchers, and the media, and that these data, these publications are used for a variety of reasons. So we've been recently contacted by and speaking to some public health specialists at Wolverhampton, Wirral and Bristol councils about how they've been using our publications and patient-level data that we're providing in those publications in order to drive activities in their area. We've also been speaking to academics and researchers at Manchester University and Sheffield University who've been using our publications and patient-level data in their research. And we know that it's taken and used by the media quite a lot and used in national outlets such as the BBC to inform the public of important or topics of public interest. So, what the future holds. We are, at the minute, working on a brand new publication to put out for people. And we've probably heard today a lot about people using the item level data that we publish, which is the English prescribing data set, or the data that is published by Open Prescribing. And people use that item level data because there isn't a comprehensive source of patient level data at the minute, and we're looking to try and remedy that. And so we want to put out more patient level data for people to use and build new and exciting things on top of. These are just some of the areas that we've kind of thought of. We're in the very early stages of idealising what we want to publish, but these are some of the areas that we're looking to focus on. So looking at initiations and ongoing treatments, antimicrobial stewardship, which we've heard about already today, long-term opioid usage, which we've already heard about today, deprivation, which people have spoken about as well. So I think we're kind of in the right kind of sphere already. But we do know that there's lots of things that lots of people can do with this data. So if you do have a brilliant idea of something that we could do with patient level analysis, then please do let us know. either come and talk to me, or you can send as an email to statistics@nhsbsa.nhs.uk. We aren't giving up prizes for the best idea, but you'll have, I suppose, some self-satisfaction when you see the publication come out. Thank you very much.